Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
Hi everyone, welcome to another episode of the Egg Whisperer Show. Tonight's show is all about the 10 things that IVF doesn't do for you. I'm a very positive person. I wear my fertility cheerleading skirt every single day, so it kind of sounds like I'm being a little bit negative right now, but I'm not trying to be. I just want you to be informed about what IVF can and can't do for you. Because if you know the limitations, then you're not making assumptions. And I hear this all the time where patients say, well, I want to do all this treatment before and then I'm going to do IVF because IVF is going to work. Well, that's actually not how it works. So I want to take you through the 10 things now. So the first one is that IVF doctors are not medical deities. We're not. MD doesn't stand for medical deity or God. It stands for medical doctor. And medical doctors work with science. They work with your biology. We can't turn bad eggs into good eggs. I mean, I'd like to think that I do have this special sauce and hocus pocus types of supplements and, all sorts of things, including the very best protocols to give every patient their best chance. But at the end of the day, like I said, I can't turn a bad egg into a good egg. I can only help people with what they already have. I certainly don't take credit for the success that I have. And at the same time, when there are cycles that don't work, I just make sure that we've done everything possible to give everyone their very, very best chance. So along those lines, how do you do that? Well, you check your fertility levels and look at sperm counts and make sure your uterus is perfect. Do implantation testing, do advanced DNA tests. Well, these are all the things that you can do first. And there was a study that I was just quoted in on CNN.com. You can find the link, we'll post it. And basically what it says is that fertility levels, when they're low, people still get pregnant, and that's no surprise to me at all. So I believe in the fertility of every single patient that comes in. And if your levels are low, it doesn't mean no. It doesn't mean no pregnancy. It doesn't mean you still shouldn't try. It doesn't mean that you can't get pregnant with IVF, because your levels are just part of the picture. Your age, your follicle count, your genetic profile, your environment, sperm quality, uterine, the uterine anatomy, all of those things plays a role. And at the end of the day, we have as much control as we'd like to have when we do IVF, unless you're Kris Jenner, of course. If you're Kris Jenner, you can plan 3 pregnancies for all your daughters at the same time, and she is my version of a medical deity. No, people, that is a conspiracy. You can't do that. Pregnancy rates are at best 15% per cycle for every human, unless they're bunnies. Maybe they are. I don't know. I'm not treating any of the Kardashians. But what I know is that they're pregnant, supposedly, allegedly, but they're all at different stages of their pregnancy. And the thought that someone is possibly masterminding 3 pregnancies in one family, yeah, probably not. But I thought it was pretty fun that I was quoted in this article, actually, this morning. So one of the next things that IVF doesn't do for you, and it's very, very true, is IVF does not improve your self-esteem or your relationships. So you need to nurture those relationships. You need to take care of yourself. You need to find a fertility friend, a fertility pal, join a support group. Take advantage of acupuncture. An acupuncturist is basically another cheerleader on your squad. So those are the kinds of things that you want to think about before you do your cycle, not after the fact and feel so down or just feel defeated or just drained, even if you have success. And we all need a little bit of support at times in our life. And when you're going through fertility, there's no better time to get the support that you need. The next thing that IVF does not do for you is improve your mood. So find ways to improve your mood. Use a simple mug that says "like a boss." I wear a t-shirt that says, I don't just act like the boss, I am the boss. And that kind of puts me in a good mood. Well, I also wear special socks and maybe special pants. And, I have books with daily inspirations. There's so many different things that you can do. There are apps that will send you daily inspirations to make sure that your mood is where it needs to be as you're going through this process. Because while some people might feel euphoric being on all these drugs, it's better to have the expectation that you might kind of feel sort of lousy. So before you go through the cycle, think about things that you can do to improve your self-esteem relationships, like couples counseling if needed, seeing a therapist, and then think about ways to improve your mood on a daily basis. So the fourth thing that IVF doesn't do for you is improve your sex life. It doesn't, because guess what? You have people telling you have sex, don't have sex in a cup. Yeah, no, thank you. And you may actually have sexual urges. The woman might have sexual urges, the male partner might have sexual urges, and how do you deal with that? So you need to talk about that. So for my patients, we actually talk about these things. When to have sex, when not to have sex, when to abstain, when is it okay to be intimate? And orgasms, or what I call outer course, is almost always okay in my world. And yes, I did just say outer course. The next thing, the fifth thing that IVF doesn't do is cause twins. In the old days, and when I say old days, I'm saying like 5-7 years ago, every time I said IVF, people would say Octomom, and it's like, no, that was not an IVF pregnancy. And just this year, a really cute video was posted on Ellen's show about a woman who did IVF, and she ended up with 4 babies. Well, the way that happened is 2 embryos were transferred, or I should do this, and then they both split into 2. The chance of that happening is like 1%. It's it's actually less than 1%. It's super low. I don't even think, I might have seen it one time in my life, but I never had all 4 actually, unfortunately, deliver quadruplets. So the rate of that happening, super low. So before you do IVF, realize that IVF isn't what causes twins. What causes twins is ovulating many eggs, and you don't have control that way. But the number of embryos that you're going to get is the number of embryos you put in, unless you're part of the 1%. So the next thing that IVF doesn't do for you is IVF doesn't give you frozen embryos, unless you're planning what we call a frozen embryo transfer. So listen to this. You're 37 years old, you're about to do your first IVF cycle, you don't have any other kids at home, and you have one beautiful embryo and nothing to freeze. Well, before you put that embryo in, reconsider that option. Consider freezing the embryo so that you can do another cycle so that you have embryos for your future. Because if you're already starting at 37, the chance of having a second baby at 39 or 40, if you're already needing IVF treatment, it might be lower. I don't have that kind of crystal ball, but I want to prepare patients for their future so that at least you look back and say, oh, goodness gracious, I'm so glad I have these options. Because at the end of the day, we all want options, and if you don't have to use them, well, that's okay too. So IVF can cause disputes, okay? So when you're doing IVF, people don't always get along. So if you're about to sign consent forms for your IVF cycle and you realize there might be a discrepancy between you guys as far as what you want to do if potentially your relationship dissolves after your IVF cycle, well, talk to a lawyer first and think about other options like egg freezing. The time to think about that is before your egg retrieval, not after the fact, not after you've had a baby and now you're sadly going through a divorce. So I've been through those kinds of scenarios with people, and I don't want people to suffer emotional harm after you've created embryos. So think through those things. If you're a woman, it's tough because as you get older, you know, your fertility may have declined. But if you're a guy, you know, you can make more sperm after a few years, most likely, if your sperm was good for an IVF cycle. So people don't always get along. And then the next thing is that IVF doesn't make your sperm better. So you need to make sure that your sperm is in its best shape possible before you do an IVF cycle. And there are lots of ways to put your sperm through what I call a sperm fitness challenge through, you know, exercise, weight loss, making sure your testosterone level is normal, getting a varicocele checked or fixed, and getting on supplements like a male fertility supplement or a prenatal vitamin. Just like we put women on, there are such things out there. So you should know about those things before you do IVF. There is a way to actually, you know, maybe pick a better sperm, and that process is called PICSI, picking a better sperm, and then doing ICSI by plating a sperm on a special dish, and it binds, and then you put it in an egg. So there is a way potentially that IVF can boost sperm if it's on the lower side, but before you even do it, make sure you're giving yourself your very best chance. The next thing is that IVF does not cause cancer. It just doesn't. It's been studied. It doesn't cause breast cancer. It doesn't cause ovarian cancer. But what it does cause is emotional distress, depression, PTSD. So when you're going through treatment, realize that some of this might happen to you, and you want to be prepared for that and be supported and find help as soon as you're starting to feel down, so that you don't end up with, those types of emotional issues after you go through a cycle that may not work. Certainly, most people who go through a cycle that doesn't work, they're not running around super happy. Not at all. That's not to be expected. You have to let yourself go through that grieving process over what could have been. I totally get that. But at the same time, I want to make sure that people realize that this could happen to them. Even after going through treatment that was successful, even being a fertility patient can sometimes make you feel down at times. So be sure to get supported, see a therapist, talk to people around you, get the support that you need so that, these kinds of things don't get you down. So the last thing is that IVF with PGS doesn't predict everything. So you need to know what PGS is. PGS stands for pre-implantation genetic screening. It's a way to look at the chromosomes in an embryo, but chromosomes aren't everything, and there are limitations to the technology. So this is what I tell my patients. You need to know the difference between normal, abnormal, and mosaic. You need to know the limitations of the technology and talk to a genetic counselor. Every genetic testing company has a genetic counselor that works for them, and you need to review the technology and again understand what chromosomes mean. We can't create a designer baby. People don't come to me because they want a designer baby. They come to me because they want their very best chance at future pregnancy, and that's really it. So I would just want to say thank you. That's the 10 things. Thanks for coming tonight and listening to me. So if you like what you hear, you can go to the website and listen to all past shows. You can also go to the iTunes Egg Whisperer channel that we have. You don't have to see us. You can just listen to these tips that I have for you. And you can also go to the eggwhisperer.com website, get your levels checked. Even if you've had your levels checked, I'm happy to review everything with you and offer you additional tests looking at things like your ovaries, advanced DNA tests for the sperm, and eggs. And at the end of the day, I hope everyone gets ahead of infertility. Give yourself your very best chance of getting pregnant at home. But at the end of the day, fertility doctors like me are here for you. So I look forward to talking to you about more fertility topics that are near and dear to my heart in the future. See you soon.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Avazadeh.
And you have yet another success story.
Just launched by an East Bay fertility doctor.